Ontario is bearing the brunt of these mutated forms of the virus. It has the most cases of the variants compared to other provinces. But those variants are taking hold in much of Western Canada. Nearly all of Saskatchewan's new COVID-19 cases are from the B117 variant, and they're concentrated in Regina. As Roberta Bell reports, there are calls for more restrictions.
Certainly the fact that we're the hot spot in the country does make me concerned.
A year ago today, everyone was thinking it was going to be over in 2 weeks.
In the early days of the pandemic, there were proportionally very few COVID cases in Saskatchewan's capital. For a period of weeks last spring, there were actually none at all. But now, public health officials say they're watching Regina closely.
2 weeks, 3 weeks ago, we couldn't predict where the variants of concern would take over. Right now, they've taken over in Regina.
There are 527 active COVID cases in Regina. 489 of them, 93%, are confirmed or presumptive variants of concern. This epidemiologist warns it won't stay local for long.
We are seeing a surge in Regina, but it will soon be seen in other communities in Saskatchewan as well.
In fact, as of Thursday, Saskatchewan reported a total 568 confirmed or presumptive variant of concern cases, making up 44% of the province's 1,282 active cases.
The nature of this pandemic is now pivoting to a more threatening, a more dangerous phase.
Regina Mayor Sandra Masters says she's watching the situation closely.
My offer was we're prepared to do anything that the Chief Medical Officer is thinking will be necessary.
Restrictions in Saskatchewan relaxed last week to allow expanded household bubbles of up to 10 people.
Regardless of what you're allowed to do, just because you can doesn't mean you should.
While Regina residents aren't facing any new public health orders, provincial officials say vaccines are being diverted to them in a race against the rapidly spreading variants. Roberta Bell, Global News, Regina.